Chairman Oliver and Baker, members of the committee, I want to thank you for the opportunity to confer on the Pennsylvania House's decision to repeal the prohibition of marijuana as medicine in the Commonwealth of Pennsylvania. My name is Rosenzweig, and I am a 26-year-old software engineer from Philadelphia. I'm also the secretary, previously co-chairman of the board of directors of the Philadelphia chapter of the National Association.
Excuse me, I apologize. We're already 10 minutes, 15 minutes past our deadline. If at all possible, to the extent possible, if you could summarize your remarks. We're losing members, and there's not many left, and I think that's going to get worse as time goes on. So if you could summarize, we appreciate it. Thank you.
In 2005, I and other gays activists started the Pennsylvanians for medical marijuana in an effort to raise awareness on the topic and to bring legislation here so that we can have this issue debated. The debate for taxation and regulation has taken place nationwide, and many see it as the only viable replacement system for the failure of prohibition. But patients here in Pennsylvania do not have the luxury of waiting for a complete repeal of marijuana prohibition. They need the medicine now, and they need protection from the law now. Now, while we as a nation discuss the end of marijuana prohibition, let's at least ensure that those who really need marijuana as medicine can get it legally and without fear of arrest. There's one thing that scientists, lawyers, police, doctors, patients, politicians, hippies, and the U.S. public can agree on is that marijuana is medicine, but jail is not. A little bit about marijuana now. Marijuana is a plant that produces cannabinoids such as THC, cannabidiol, and cannabidiol. People use marijuana by smoking, vaporizing, or cooking into food and drink in its various processed forms. These forms include simply the dried, cured buds of the plant, or the female plant, the processed buds, which can make hash, keef, hash oil, and other tinctures, which have been previously available before marijuana was made illegal in 1937. Humans have used marijuana for religious, industrial, cultural, social, medical, and recreational purposes for over 5,000 years. Cannabis acts upon the human body using a system known as the endocannabinoid system. Just like the human body contains opiate receptors, it also contains receptors which the various cannabinoids in marijuana bind to, either activating or blocking it. Cannabinoids are the chemicals in marijuana which mimic functions of chemicals that our body produces normally. THC is an analog of anandamide, and is the only psychoactive ingredient in any quantity to have a direct effect. CBN and CBD are non-psychoactive, but they do play roles. As was previously mentioned, I'll skip over this part since it was talked about. There is no record in the extensive medical literature describing a proven, documented cannabis-induced fatality, and the same cannot be said for other drugs. In 1988, the DEA responded to a petition to remove marijuana from Schedule 1 and place it into Schedule 2, where by definition it has no value. DEA Administrative Law Judge Francis Young concluded in his landmark ruling, at present it is estimated that marijuana's LD50 is around a ratio of 1 to 20,000 or 1 to 40,000. In layman terms, this means that in order to induce death, marijuana smoker would have to consume 20,000 to 40,000 times as much marijuana as is contained in one marijuana cigarette. NIDA supplied marijuana cigarettes weigh approximately 0.9 grams. A smoker would theoretically have to consume nearly 1,500 pounds of marijuana within about 15 minutes to induce a lethal response. Marijuana has a currently accepted medical use and treatment in the United States for spasticity resulting from multiple sclerosis and other causes. It would be unreasonable, arbitrary, and capricious to find otherwise. Unfortunately, his ruling was not binding, and marijuana was not rescheduled as Judge Young ruled. It was this ruling that forced activists and patients to go the route of state-sanctioned medical marijuana laws, either through ballot initiative or legislative action. Starting with California in 1996, we now have 13 states currently running medical marijuana programs. 6 states which have medical marijuana bills that are still alive, including this one here in PA, and 4 states which held votes to expand their medical marijuana programs. Over 25 million Americans now live in a state where marijuana is available to them as a medicine. Something we can all agree on is that we do not want our children and teenagers using drugs unless prescribed or recommended by the physician. Advocates of prohibiting marijuana's use as medicine frequently bring up arguments meant to scare you, such as legalizing marijuana sends the wrong message to children, or legalizing marijuana will make marijuana more available to children. Let's make something clear. Children and teenagers do not look at the sick and debilitated patients using medical marijuana and think, gee, I want to be like that. As Bob from MPP pointed out, according to a report compiled by the Marijuana Policy Project and updated in June 2008, marijuana use by teenagers has gone down in every state which has instituted a medical marijuana law. All states have reported overall decreases exceeding 50% in some age groups. MPP's report is included with this testimony for your consideration. Marijuana use becomes deglamorized in the eyes of young people because of its new context. So we've established that marijuana is a safe and effective medicine. However, the FDA has not approved it for medical use, and it remains in Schedule 1 of the Controlled Substances Act. Unfortunately. As was mentioned before, there's a program called the Investigational New Drug Program, which was created specifically to deal with the marijuana issue.